Our today is about delivering excellence across business sectors. Our today is about building a future-ready nation. Our today has a strong foundation with community at its core. Our today is dedicated to the communities we serve. Our today is always about more than just today. Our today is a continuous journey for a better tomorrow. Tata, leadership with trust.
Shapoorji Pallonji is an 153-year young, not old, engineering and construction conglomerate. We have a dream to engineer a better planet. We have a dream for Africa to engineer a super Africa. At Shapoorji, our dream for Africa was born a good 13 years ago. At Shapoorji, we believe that Africa and India were born of the same seed. We believe that we have a lot in common and that we can develop these two continents to the mutual benefit of each other. Today, I can proudly say that we are in over 20 different countries in Africa. Our objective at Shapoorji is to enjoy customer trust and to deliver iconic projects on time. We are and have been an international organization for 48 years. In order to focus our vision on certain areas, we would like to have a strategic growth in Africa in the following areas: solar and storage, large-scale convention centers, mass housing, large marine projects, large infrastructure and connectivity projects, large oil and gas projects. At Shapoorji, we endeavor to touch the lives of people in a beneficial manner in whichsoever country or geography that we put our foot into. We would like to come to Africa to enrich the social culture, the social fabric of the entire continent. We would like to come to Africa to enrich ourselves with the culture of the various different African countries. We plan at Shapoorji, we envision at Shapoorji, our focus at Shapoorji is to be in Africa for another 100 years. We would love to make investments in Africa and see Africa grow and grow together with Africa.
In 1868, the Tata Group was founded on a philosophy that put the community at the heart of its existence. Today, we are a $100 billion global enterprise. Our today has been built on enduring values. Our today is about delivering excellence across business sectors. Our today is about building a future-ready nation. Our today has a strong foundation with community at its core. Our today is dedicated to the communities we serve. today is always about more than just today. Our today is a continuous journey for a better tomorrow. Tata, leadership with trust.
Shapuji Palanji is an 153-year young, not old, engineering and construction conglomerate. We have a dream to engineer a better planet. We have a dream for Africa to engineer a super Africa. At Shapuji, our dream for Africa was born a good 13 years ago. At Shapuji, we believe that Africa and India were born of the same seed. We believe that we have a lot in common, and that we can develop these two continents to the mutual benefit of each other. Today, I can proudly say that we are in over 20 different countries in Africa. Our objective at Shapuji is to enjoy customer trust and to deliver iconic projects on time. We are and have been an international organization for 48 years. In order to focus our vision on certain areas, we would like to have a strategic growth in Africa in the following areas. Solar and storage.
Stop the videos now.
Large-scale convention centers, mass housing, large marine projects, large infrastructure and connect.
Yeah, so Ambassador Gurjeet Singh, good afternoon, sir. Some of the panelists are here. If you'd like to have a few minutes with them, you could before we start. We start in another 6 minutes or so.
Right. Thank you, Kavita. So, dear panelists, I have been told that everybody will get 5 minutes. So, please do stick to the time. At 4 minutes, I will say you have 1 minute. Please do conclude in that next minute. Secondly, there are very focused 4 questions which CII has put in their introduction. Specific ways of partnership, opportunities for Indian private healthcare, how can Indian industry contribute to capacity building and scope for joint R&D. So I propose that we discuss only these issues and in a focused manner. So at the end, I can have a set of recommendations which we can give CII to take forward. That makes for a useful session. I would request you all to please focus on these issues only and within the time frame. If you don't want to focus on all the issues, it's fine. You can pick one or two issues from these which are of your preference and just speak about it. And we will avoid speaking about vaccines because there is a succeeding session on vaccines. So this is entirely about healthcare, pharma, medical devices, infrastructure, that kind of thing. We are not going to be discussing vaccines. Thank you.
Ambassador, this is Diptendu Bhattacharya from Godrej. I'll be speaking about the cold chain equipment for vaccines and not vaccines per se.
Yeah, that's good. That's good. Yeah, cold chain equipment is good because that is one of the infrastructure parts.
Right.
Yes, that's fine.
Thank you.
But can you also, with somebody from the Indian side, cover capacity building? How we can work with Africa on capacity building?
Yes, Ambassador, this is Gautam Kumtaka from Shapoorji Pallonji. I shall be displaying some models on capacity building as well.
Very good. So if you're making a presentation, please remember 5 minutes, is it?
Yes, sir, I just need 5 minutes. That's all.
Okay. The first question is very important. In what ways can India partner Africa in augmenting region's public healthcare system? So the gentleman from Godrej, you just spoke. You know, while you speak about cold chain, I would also like you to speak how this is going to be financed or what ideas you have for it.
Frankly, I haven't touched on the financing part. In our experience, the UNICEF has been a major financier for some of the projects we've been engaged in. They are pretty large-scale projects in Mali and Niger, and I can touch upon that.
Yes, please give that example. That gives a good idea of what you've actually done in some African country. I think that is most useful.
Sure, sir.
Thank you. Mr. Sisodia, what will you speak about mainly?
Yeah, so good afternoon. I'll be speaking about our presence in Africa, our experiences in Africa. You know about us in Ethiopia as well. I'll be talking about it, our expansion plans in Ethiopia, we are going to talk about, and how we have been helping in these times, about the digital initiatives also, which have been very well received by the medical fraternity. So,
can you also touch upon the lack of common registration procedures?
okay. Yeah, sure. Can do that.
So everybody talks about the African free trade area, but there is actually very little progress on common registration procedures for pharmaceuticals. Dr. Diwan, what would be your main focus?
Sir, you're on mute, I guess.
So I'll be speaking on Tele ICU, which is a innovative way of monitoring emergency patients in the remote areas of the world. So we'll be sharing some data that we have done in India and outside India.
Great, that's very good. So have you done anything in Africa?
I have a small presentation on that.
No, have you done any project in Africa? Could you give an example?
No, we have projects in Nepal, Bangladesh, Papua New Guinea, and Samoa Islands in South Pacific Ocean.
How were those funded?
They're doing very well.
No, how did you fund them?
So the governments have opted for our healthcare solution to manage the emergency care in those remote parts of the country. So these are a mix of private and government projects.
Super. This is again a very useful different. Great. I think on the Indian side, we are organized. I don't know about whether our African colleagues are online yet. I can see Minister Milan from Equatorial Guinea. Honorable Minister, can you hear me?
Very well. Can you hear me?
Yes, I can hear you from Equatorial Guinea, from Honorable Minister of Botswana. Can you hear me?
I can hear you very well. Can you hear me?
Very good, very well. What about our other colleagues? Are they here yet? The Minister, the Chief Administrative Secretary from Kenya, and the Minister from Zimbabwe. So, Excellencies, I just wanted to say that my instructions were to give you precisely 5 minutes. And at 4 minutes, I will say you have 1 minute. Please try and conclude in that. We really would like to hear from you what you expect from India's private sector in particular for your public health, or your capacity building, or the region's public, investment by Indian companies, and the scope for joint R&D. We would not be discussing vaccines in this session, for which there is a succeeding session. But I'm very happy that both Equatorial Guinea and Botswana are here, because I think with them both there is a complementarity that India has with which we could take. So now I'm in the hands of CII to start when they say so.
You may start, please.
Ambassador Singh, you can start the session, please.
Right, thank you. Good afternoon, ladies and gentlemen, honorable ministers and dignitaries from Africa and from the robust Indian private sector. I am delighted that we are beginning the third day of this important conclave, and we'll today be discussing the revitalization of Africa's healthcare systems for a brighter tomorrow. If you heard the speeches yesterday and day before, particularly from the ministers, you realize that healthcare is now the top of the agenda. And even the foreign minister of India indicated that healthcare could be a major area of cooperation ahead. So today, we have a very distinguished panel and high-powered panel. And we are going to look at broadly 4 questions. How can India and Africa partner to improve the public healthcare systems in Africa? The documents of the India as Africa Forum Summits since 2008 all have important segments on this, but perhaps the focus and emphasis has been lacking. The second question that we need to address is what are the opportunities for Indian private sector to invest in Africa, and how can they take part in Africa's growing healthcare story? What incentives do African countries provide? Issues of incentives could probably come through the Africa Continental FTA, but the harmonization of healthcare standards, the common registration procedures for pharmaceuticals, these require the African Medical Agency and the Pharmaceutical Plan for Africa to both come into operation more quickly. Another issue which we can discuss today is the capacity building, both human and physical, on healthcare and pharma sector. India had implemented the Pan-African e-network project, which had telemedicine as part. I understand that all this telemedicine infrastructure is still available in 47 African countries. Is there any plan to utilize the capacities already built by that for developing further healthcare while we look at e-Arogya Bharati and other private sector solutions? And finally, what is the scope for joint research and development in life sciences, biotech, medical equipment, and epidemiological studies? The Indian Council of Medical Research has a valuable partnership called the India-Africa Health Sciences Partnership with the African Academy of Sciences. 100 participants have been trained in those programs, in 7 programs in 2019 and 20. And now the EITech program has also helped to build these capacities. But can we actually have joint research and development in this? I would love to hear about this from various participants, particularly because India has been providing, CT scan machines, Babatron machines to various African countries. But often after the initial period, local budgeting and maintenance then becomes a problem. So these issues of practical nature need to be addressed. With those opening words, I have great honor to invite Dr. Edwin G. Dikolodi, guest of honor and the Minister of Health and Wellness, Republic of Botswana, kindly address the session now. You, sir, have 5 minutes from now. Welcome, Excellency.
Thank you very much, moderator. In the interest of time, I'll just say protocol observed. Greetings. The moderator, it gives me great pleasure to participate in this auspicious event, which concerns itself with revitalizing the healthcare system in our region, Africa. I wish to applaud the organizers for their thoughtfulness for engaging in a very important issue that could not be at a better time than now when the whole world is grappling with the devastating effects of the COVID-19 pandemic. As the world continues to wrestle with the wide-reaching impact of the COVID-19 pandemic, the importance of strong and resilient health systems has to come to the fore. The ability of the African continent to respond to the global infectious disease threats has lately been put to an insurmountable test. As governments from the Africa region, we cannot afford to become complacent. We are looking to strengthen all of our health partnerships across the board. The agency of dual pandemics demands no less. The time for strategic and coordinated well production partnerships could not be more timely. COVID-19 pandemic has revealed more inequalities amongst nations, and it has made it clear that relying on a few companies for production for public needs can be catastrophic. We need long-term commitment by all nations, strong political will, and a change of mindset to realize this ambition. In the realization of the interconnected world, the IHR were developed through an extraordinary global consensus as an essential vehicle to address global health security. In March 2019, the IHR capacities in the WHO Africa region were subjected to an independent joint external evaluation. The evaluations revealed that no African country had all the required IHR capacities to deal with emerging and re-emerging infectious diseases. Some of the major gaps observed included the technical areas of biosafety and biosecurity, preparedness, emergency response operations, medical countermeasures, and personnel deployment. These areas present opportunities for partnership in the quest to strengthen the African continent to respond to global health threats. India and Africa can cooperate to urgently establish robust national public health capacities, infrastructure, and processes. These decisive actions are needed to ensure that people in the Africa region are better protected from epidemics and other public health emergencies, which is a key ingredient to trade and wealth creation. The main causes of morbidity in Africa are similar across the continent. Just like in Botswana, the most common diseases or disease categories are acute respiratory infection, pneumonia, pulmonary tuberculosis, intestinal infection, diarrhea, HIV/AIDS, and trauma and accidents. NCDs such as cardiovascular diseases, cancer, and diabetes are also rapidly increasing in the region. These diseases give an indication of the types of essential medicines that are likely to be in demand in Africa. In order to optimally utilize the evident limited resources, Africa regions could easily consider concentrating on investing on specific commodities and establish excellence in those. 1 minute, sir. These technologies could ultimately be shared amongst regions and avoid duplication of effort. The need for high quality, safe, effective, accessible, and affordable medicines is a reason to form such robust partnerships. Currently, there are no companies that manufacture pharmaceutical medicaments in Botswana, and most African countries, has the country's heavy reliance on imports to meet its pharmaceutical need. This highlights the urgency with the local capacity which needs to be developed. Botswana's pharmaceutical imports comprises both raw materials and pharmaceutical medicaments, inclusive of devices. Botswana's overall import bill stands at about 70 billion pula, and the pharmaceutical import bill alone stands at 1.6 billion. This implies an untapped market for this sector and provides an opportunity for investment in this sector. It is against this backdrop that the government of Botswana has taken a deliberate decision to reduce its import bill and reduce the risks associated with the importation of pharmaceutical products by attracting investors in this sector to set up in Botswana and manufacture pharmaceutical products from the country. These investors are envisioned to supply the local market as well as the Africa market. There is an opportunity to focus on ARV generic production, given the huge demand for such medicines. Research and development and sharing of intellectual property and secrets are the cornerstone for the development, but especially sharing information between South and North and between South and South states. For Africa to develop, collaboration in this area with India will go a long way in forging its development agenda. Innovation can take place in technology, product development, manufacturing processes, and business models. I thank you, Mr. Moderator.
Thank you, Your Excellency, Honorable Minister, for pointing out very valid and valuable areas where our cooperation could be headed. I have great pleasure now in inviting next guest of honor, His Excellency Dr. Diosdado E.N. Milan, Honorable Minister of Health and Social Welfare of Equatorial Guinea. You have 5 minutes, sir. Please start, sir.
Yeah, okay. Thank you very much. Your Excellencies, all protocol observed. I'm happy to participate this morning at this very important meeting. And really, Equatorial Guinea has been having health development based on the own government and the multilateral partners. Very few bilateral initiatives we had, especially with the state. So having this type of collaboration with India is highly welcome, especially in strengthening the public health system in Equatorial Guinea. The fields are still very wide open. In Equatorial Guinea, we have the following assumptions that could consider on the basis of strengthening partnership with India on Africa's public health matters. Our health infrastructure with essential services like drinking water, electricity, basic sanitation are available, that they are well equipped, that they are maintained and distributed equitably to meet the demand of the population. Again, in the training personnel, health personnel, we need to train health personnel, especially on public health. We have got medical specialties in the hospital, but the public health has been a bit negligent because we had some hospital-based approach, which we are changing now to community-based approach. Essential drugs are available and affordable price for the population, but these are very expensive. We are getting them mainly from Europe, and we think that getting them from India, we're already getting some antiretroviral drugs from India. If you can increase the scope of this, that would be very, very interesting and very important opportunity for cooperation with India. Again, in Equatorial Guinea, we don't have a pharmaceutical company, drug production. So this year now, with the impetus of the president, our president, we are trying to create a pharmaceutical company to fabricate drugs. So I think India could come in this time because we're still planning, and in the planning process, India could come in and see how we can get actually support from them, because now we are based on the South-South cooperation. We have a Cape Verde, which has got a very good drug production plant that is supporting us. So we hope India could also come in. Again, in terms of what India could also do, the private healthcare, we need specific programs which are not very well implemented, like maternal, neonatal, infant, adolescent health, the quality of health services, and the communicable disease is very important, because as I said, we have been dealing with our approach has been very hospital based, and now that we're implementing community based, because our health development is based on the district health development. So we need some new input and approaches how to address the community, especially the non-communicable diseases from the periphery, and not only treatment.
1 minute.
Thank you very much. Yes, and of course, in research and development, we have a faculty of medicine, which is mainly supported by Cuba and Spain. So India could come in also to help us in developing this faculty of medicine. We have only about 10 years of lifespan. So these are, in brief, the opportunity that India has to collaborate with Equatorial Guinea. You are very much welcome, sir.
Thank you so much, Honorable Minister. In fact, India has opened a new embassy in Equatorial Guinea, and we have a very bright young ambassador there. So I'm sure the idea that you have given us today will bear fruition, because new cooperation plans can be set into motion with the help of the Indian embassy in your country. Thank you so much for telling us about the public health system and the nature of diseases and how India can come in. I'm sure the Indian private sector has taken good note. With that, I now have great pleasure in moving to the third guest of honor, His Excellency Dr. Rashid Aman, Chief Administrative Secretary for Health Republic of Kenya.
Yes, thank you.
Habari, and you have 5 minutes.
Habari Muzuri. Thank you very much for inviting us to this meeting. It's a pleasure to participate in this conclave. Let me begin by a few remarks before I address the particular questions that were posed. I want to inform you that as I think we both know, India and Kenya, that we have had a very long historic relationship. The relationship between Kenya extends to pre-colonial times. And of course, we have very close links because of a large Indian community that lives here in Kenya that for several generations. So there's a special relationship, and in trade-wise, we have had a long-standing trade relationship with India. Let me just briefly give a synopsis of what, as a country, we're doing in terms of trying to improve our economy through development, through partnerships with external partners. We are creating an environment that is conducive for foreign direct investment. In the area of ease of doing business ranking, we have also improved very well because of the systems that we have put in place. We have set up several economic processing zones that provide advantages to those who want to invest in this country, as well as specialized economic zone. One of them is called the Konza Technopolis, which is just outside of Nairobi, and which we are earmarking for really high-tech bioscience investments. The country as a whole now, we are pursuing a program of universal health coverage, a massive program of universal health coverage, which is one of the big four agenda of our president. The idea being to be able to provide universal health coverage to all Kenyans in the shortest possible time. Let me now move to the questions that were posed and respond to each one briefly. In what ways can India partner with Africa in augmenting the region's public healthcare system? Now, with respect to Kenya, we believe that there are great opportunities to partner with Kenya. Some already do exist. We have a number of pharmaceutical manufacturing plants here, about 38 of them. And you are aware that most of these manufacturing plants are actually owned by Kenyans of Indian origin. And in that regard, they have been able, at their private level, establish collaborations with Indian manufacturing firms. Some of them have partnerships in these areas. So that's an area we believe we can expand. One of the big agendas of the country right now, in light of the COVID-19 experience, is really to promote local manufacturing of pharmaceuticals and non-pharmaceuticals. And I think that is an area of opportunity there. When it comes to the position of healthcare and healthcare service, we believe we can gain a lot by working with India. As you know very well, India is one of our destinations for medical tourism. Many of our people come here for treatment from Kenya and from the region. We would like to build capacity within this region to be able to promote that kind of collaboration, but also be able to provide that service here locally. And we believe by training with Indian institutions and academic institutions, we can improve the level of healthcare training within the country, health specialists. We can embrace technology to be able to do digital training and digital exchange of information and diagnosis to support those who are seeking care within the country itself. Are there opportunities for Indian private healthcare majors to invest in Africa? Certainly, I think the ground is open, and not only in Kenya, but throughout Africa. There are great opportunities here. The pandemic has opened up the realization, at least at the political level, for the need really to move towards self-reliance in some of these areas. And hence the environment has been created where investments can be made with partnerships to be able to produce products that we require, health products and technologies.
A minute, sir.
Yes. How best can Indian industry contribute to capacity for Africa's healthcare and pharmaceutical sector? We believe that it can contribute greatly through partnerships with local pharmaceutical and healthcare industries. You can contribute towards faculty support to start training in new areas of medicine, such as oncology, emergency and critical care, assistive technology and rehabilitation medicine, transplant and regeneration medicine. And we form a robust relationship by twinning arrangements with local hospitals and local institutions. In terms of scope for joint R&D in life sciences, biotech, medical equipment, and epidemiological studies, I think this is an open field too. And again, COVID-19 has brought home the fact that we really need to invest in R&D to move forward. I believe India is well advanced. It has walked that path. And I believe that experience of collaborating with us and transferring technology here would be most beneficial to both countries. So we are open to explore those areas of collaboration. Thank you, Chair.
Thank you very much. I think you gave a very good idea of all the 4 questions with some ideas on each of them. I'm sure the Indian private sector has taken note of your openness and what has already happened in Kenya with Indian and other participants. So, whether in hospital, public healthcare, pharmaceutical. So I think that is most useful indeed, sir. Thank you so much.
Thank you.
I have great pleasure now inviting the guest of honor, His Excellency Dr. C.J. Mangviro, Deputy Minister of Health and Child Care, Republic of Zimbabwe. You have the floor, sir.
That would, yeah. Thank you, Mr. President. Good morning, everyone. I'm quite honored to be part of this Confederation of Indian Industry Exim Expo Conclave, India-Africa Project Partnership on the 15th of July 2021. Of course, it's a virtual meeting, but it's quite interesting that we are part of it. And warm greetings from Zimbabwe, my president, and all Zimbabwean citizens. So the idea is to revitalize Africa's healthcare system. Mr. Chairman, allow me to express my gratitude to the Confederation of India Industries for hosting this event, especially at a time when health systems everywhere are facing litmus tests of their resilience to respond and manage the contagious COVID-19 virus. Ladies and gentlemen, COVID-19 pandemic has been a wake-up call to health systems, especially in Africa. Our state of preparedness to have the most basic but essential items in place was rather shocking, as we met with glaring gaps. The level of capital investment in healthcare systems is extremely low in the African setting, and this is a serious handicap. What we require is to strengthen the arrangement of healthcare services and put in place the required infrastructure, equipment, commodities, and medicines. Our populations are growing, and there is a greater need to avail healthcare services closer to the people. Hence, public-private partnerships need to be explored to cover up the gap in healthcare service delivery. These partnerships should be client-centered and address the needs of the population without impoverishing them. Innovative healthcare provision options need to be explored that bring in the necessary partnerships to equip and avail a service to the population. India is well placed to understand the poor settings we are talking about. However, with the capacity that India has, sustainable healthcare provision can be achieved in Africa through adequate equipping of virtual hospitals, which can act as bridge for adequate infrastructure. Medical teams can be fully supported and linked to the commodities via mobile communication platforms, and services can be rendered from a remote place. Drone technology has been tested in Rwanda to deliver medicines and blood. Why not expand on these best practices? Ladies and gentlemen, there's need for better collaboration between industry, tertiary level education institutions, and healthcare systems. Localized solutions to solve needs in diagnostic and life-saving equipment can be improved on through technology transfer between Indian companies and African companies. A good example is the most recent challenge we all faced when India halted the supply of vaccine under the COVAX facility. We remember that well. This was a rude awakening to major gaps in Africa's pharmaceutical industry. Let's explore opportunities being lobbied for under the AU, not only in pharmaceutical production, but health commodities and equipment as well. Medical tourism has given India world visibility because of its level of sophistication and affordability. However, the majority in need of these services do not have the resources to travel abroad to access these services. Bring the specialized services into Africa through a reverse medical tourism concept, assisting in developing centers of excellence in Africa and expand your technological advancement footprint in Africa. In Zimbabwe, we are pursuing specialized research hospitals for reverse medical tourism, and we are looking at partnerships with willing Indian companies to ensure that this is a success. This should include technology transfer for sustainable operations, be it in commodities or equipment supply and maintenance. Franchises are not only in food and fuel, but can also be in healthcare systems. The cooperation in alternative and complementary medicine development is required. India is developed in this area, and our people are becoming more conscious of healthcare options such as natural herbal therapies and treatment techniques.
1 minute, sir.
Yes? And treatment techniques. Can I continue?
Yes, sir. For 1 more minute, please.
We have to be proactive as policymakers to avail such services within a well-regulated and monitored framework. Let's explore the establishment of such medical centers and assist Africa to enhance the use of its own herbal therapies and their trade. Pharmaceutical companies are also welcome to develop own herbal therapies. Our growing African burden is in non-communicable diseases. Healthy living and health aging concepts need to be supported with robust healthcare systems that screen and detect these conditions early. While such as cancer have been prominent, there is a major gap to access to these services. Let's have more collaboration and avail the required medicines to contain this growing burden. Philanthropic activities where medical teams can come and support treatment of some of these conditions with capacity building of local personnel has been happening, and we urge that the Indian companies continue to do so. I thank you, Mr. Chairman.
Thank you very much, sir.
Submit.
And thank you for focusing on the issue of technology, which now seems to be at the core of what we can do further and what we can do deeper among our countries. And you also spoke about the potential of medical tourism and how that can also be transferred by setting up health facilities in Africa. Thank you very much for very interesting remarks.
Thank you, sir.
Ladies and gentlemen, I have great honor now to move to the panelists. And I have honor to invite Dr. Mario Augusto Caetano Joao, Secretary of State of Economy, Republic of Angola. Are you here, sir? Yes, sir. You have the floor, sir. 5 minutes.
Thank you. Thank you. Excellencies and all protocols duly observed. In 2015, the UN has set the improvement of health condition as one of the Sustainable Development Goals, with an agenda of specific and related actions to ensure healthier life for the whole world by 2030. Among the specific goals is the idea of achieving universal health coverage, access to quality essential health services, and access to safe, effective, quality, and affordable essential medicines and vaccines for all. The idea of expanding access to health services is on the agenda of the several countries, which increased spending on health by 6.3% per year between 2000 and 2017 in absolute terms, in which Angola is included. Still, it is clear that there is a need for greater investments in health. Several economic studies indicate that countries that efficiently invest more in health also see productivity gains impacting long-term economic growth. In addition to the importance of improving the population's health conditions as priority measure to increase the quality of life and eradicate poverty in the world. However, we must not seek for health in hospitals or medical centers, just as government should not see public spending on health as the main way to ensure public health. Prevention, like good nutrition and the control of high incidence diseases, depends on public strategies and policies in collaboration with human capital. On the public expenditure side, the supply of electricity for food preservation, water distribution for food hygiene, and basic sanitation to prevent the spread of diseases should be the main engines to fight the most diverse diseases. In 2017, according to the World Health Organization, around 60% of Earth's inhabitants did not have access to some of these basic requirements for human health. Angola's population is growing 3% a year, and we have been spending about 5% of our state budget on health every year to support health programs from our National Development Plan to overcome substantial public health challenges. But Angola is going through a shift to a new paradigm based on preventive health and implementing measures that enable the improvement of the population's healthy and adequate living, impacting on higher productivity and greater returns on investment in education and health. The preventing health cultures has also been incorporated by some companies in Angola, as they believe that bad health habits create unhealthy individuals, negatively affecting the workforce and workplace. To this end, companies today are already adopting policies of food nutrition, of good nutrition, physical activity, and mental well-being into their work culture, allowing for faster diagnosis of illnesses and giving the opportunity for considerably longer life expectancy. Investing in human capital not only provides high rates of return, but it is also a smart insurance against adversity. The COVID-19 crisis has been a very tough test of our public health systems and has revealed the benefits or challenges of previous investments made in health, human and physical capital, as countries that invested smartly to continually improve health systems have been better prepared to answer. Angola's human capital index is just 0.36, ranked 147 out of 157 countries. This means that in Angola, today's children and youth can only reach 36% of their total productivity potential in adult
1 minute, sir.
due to deficiencies in education and health. We know that in the 90s of the last century, India went through a substantial process of improvements in the supply of critical inputs of organization and management of innovation activities in medicines, diagnostics, medical devices, and traditional medicine, being a greater partner of Africa in this field. For Angola, cooperating with India in both preventive health and health treatment, either through trade, foreign direct investment, or capacity building, is important to address public health challenges and social economic impact in the short, medium, and long term in order to build sustainably resilient human capital. We would strongly encourage India to take advantage of investment opportunities not only in generic drug and vaccine manufacturing for human and animal needs, but also from various health public assets being privatized. Thank you.
Thank you very much indeed. I think your emphasis on human capital, very important, and I think that is what we perhaps address next. When I invite Dr. Sandeep Dewan, Managing Director, Health Training Asia, to have the floor, sir, 5 minutes.
I have a presentation. Is it possible that I get the host rights, or I think I'll be able to share the screen? Yeah, can you see the screen, please?
Yes. Yes, we can see it. Please go ahead and please just stop at 5 minutes.
Yes, thank you, sir. So, dear august audience, I am representing a critical care community here. I'm a practicing physician working in India, and what I'm going to tell you about is an innovative concept of managing healthcare needs, particularly in the rural areas. We are a group of healthcare professionals which are founded in 2015, and our aim is to train, empower, and equip healthcare workers in the field of emergency medicine and critical care. At this point of time, we are one of largest telemedicine company and managing ICU beds, about 1,000 beds across 4 countries. We have India's busiest and biggest simulation training company and have trained more than 10,000 doctors and nurses across India and outside. This is our presence. As I told you, apart from India, we are present in Nepal, Bangladesh, Papua and New Guinea, and now we have just opened ICUs in Fiji, Samoa, and Tuvalu Islands. Why do we need tele ICUs? We all know that the problems in India and Africa are more or less the same. We have 5 million patients requiring ICU care. That's a lot of patients. And only 1 lakh ICU beds available in the country. This is alarmingly less. But the shocking story, and which we keep on hearing for the last few years, is that less than 50% of the ICUs have dedicated trained intensivists. So clearly there's a huge gap between what the community needs and the specialist availability, particularly in the rural areas. The problem becomes more acute in COVID, because in COVID, we were onslaughted by the huge number of patients, and a lot of them required ventilators. So there's a huge shortage of ICU beds. Now imagine we were already short, and now we have a further shortage. And that's why getting ICU beds were difficult. But more importantly, we had very less experienced intensivists and trained nurses to manage patients in the ICUs, particularly those who required ventilators. So this is an innovative solution. I would not say it, we have been doing it for past 10 years now. It's a 24/7 remote monitoring system, which we call as Tele ICU. What happens is, you can see on the left side, we have a command center where I'm sitting right now, and a team of critical care specialists is available in the command center 24/7. We attach all the remote ICUs to our all the spoke units to our hub, and intense monitoring of all the ICU patients are done through the command center. We all know that in rural areas, the specialists don't reach, they don't want to go because of various reasons. So that is why in tier 2, tier 3, tier 4 cities, this has been a boon, particularly in COVID areas in the last 1.5 years. And we have extensively worked with the government of India. It's a proactive type of care. So if a critical care specialist gets involved in the care of COVID patients or an emergency, the outcomes can be completely different. The telemedicine guidelines were issued by the Medical Council of India and the government in 2020. And after that, it's a legal form of practice in India. If I were to talk about international
1 minute,
data,
sir. 1 minute.
Sorry?
1 minute.
1 minute. Okay. So I'll just show what the solution is. This is the hardware that we do, and it's a camera cart which is mobile, through which we can see the patients. This is our software with which we integrate the medical bed and the ventilators to our command center. We get alerts in the form of emergency alerts, and we can intervene and manage critically ill patients in a much faster and a proactive approach. So this is a combination of hardware, software, and service. This is our command center from where 24/7 monitoring of the ICU patients happen. This is a site in Papua and New Guinea. This is a site in Haryana and Maharashtra. These are COVID intensive care units. And these are extremely remote areas where we are only working with nurses and RMOs. And since we all know that RMOs do not know critical care, we also do extensive training on simulators so that we can help them manage intensive care patients in a much better way. Thank you very much, Gurjeet
Thank
Singh,
you,
sir,
Dr.
for
Dewan.
your time.
I'm sure everybody found this extremely useful. I would now quickly call upon Mr. Chandrasekhar, Group CEO of Polo Health and Lifestyle Limited.
Thank you, Ambassador.
5 minutes, sir.
Yes, sir. Your Excellency, Ministers of Botswana, Equatorial Guinea, Kenya, Zimbabwe, Secretary of State Angola, the Honorable Ambassador, thank you for this opportunity. Thanks, CIA Exim Bank, for this opportunity. I represent the Apollo Hospitals Group, and we have worked across the last couple of decades very intensively with various governments in Africa. What I here would like to present is a broad perspective of what we believe should be an agenda that Africa at large could carry on with respect to how they could take the journey of transforming healthcare in the region and how India can participate. I come in more from a delivery perspective, and I want to talk about our 3.5 decades of experience. Very much the first private hospital that was created in India was Apollo. And since then, along with other players across who have also developed significantly, the government of India, I think one of the key areas that we focused on is on where we have invested in education, formal medical education, and skill development. These are areas of bigger investment, a lot of private-public partnerships, and a lot of other private initiatives. The country has invested into healthcare systems and created a conducive environment for private sector investments. Today, on the stock markets, you have a lot of healthcare stocks which are able to, and then the foreign institutional investors and others are encouraged to come and participate and provide sustained capital for further growth of these entities. So these have been very well created under regulations by the government of India. The country has also invested and created a conducive environment for pharma devices, consumables manufacturing. So a lot of supplies are now coming locally. India has leveraged tech solutions. EICU, my colleague has spoken. Apollo also runs a very significant electronic ICU program, but not on a focused fashion like our other colleague mentioned, but is a very important integral part of the care delivery at our end as well. Telemedicine and virtual consults. People are now starting to move from even desktops to mobile phones for their consultations. And that's something which is a significant growth, and COVID period has witnessed a sporadic growth there. And a lot of consultation could reach many parts without even having a physical contact. Teleradiology is another growing area. But the private sector's emphasis on primary care and preventive care is something which has now made the customer more appreciative of preventive care. I would like to state that no nation can afford to focus only on treating sickness. Prevention, early detection, forming besides healthcare, hygiene, food, environment, safety, and importantly, the education which I spoke about in terms of culture and habits of people, health-seeking behavior are key transformative steps. And India has made many such steps, both in the public sector and public health system, and via the universal health system, which has private sector participation. It is a transformative journey that the government is starting to become a payer and encouraging insurance covered patients to seek treatment in private sector hospitals besides the public hospitals. So government has moved from being provider only to also being a payer, which is a transformative journey that India has seen. My belief is that the agenda for Africa is to be built in a similar fashion. The learning from India is very transferable, both from my own organization as well as my other colleagues from the entire industry via industry forums like the CII can participate. We already are working with various governments. We have trained over 1,500 plus doctors, nurses, and paramedics. We send our doctors routinely and work with both private sector and public sector across various countries in Africa. And we would continue to do that as part of training and ongoing activity.
1 minute, sir.
The building blocks, yes, sir. The building blocks could be similar, but I would like to make one emphasis. The government focus, in my recommendation, should be on preventive and primary care and creating a conducive environment for private sector investment in tertiary care and addressing the development of stock markets, because people would like to see return on investment as stakeholders, and financial institutions' participation can be well welcomed with a robust stock markets that can work. And the second key recommendation will also be to easing the repatriation to host country for investors. That would create a very robust environment for people to want to invest further in the delivery side. If not in CapEx, CapEx can be taken from development funds, sovereign funds, and we are in the process of partnering there and creating a last mile financial sustainability. Thank you, sir.
Thank you very much. I think you raised a useful point about insurance becoming more widespread in India. I think it's also becoming more widespread in Africa, which allows the patient's cost to be covered and therefore opens up many of the avenues which you have mentioned. Thank you. Useful presentation indeed. Excellencies, ladies and gentlemen, we were supposed to be joined by Ms. Lelis Neme, Investment Commissioner from Ethiopia. But unfortunately, there has been a demise in the Ethiopian Investment Commission, preventing her from joining us today. I'm sure you will all join me in conveying our condolences to them through this forum. I now would like to call upon Mr. Mahidhwaj Sisodia, Executive Vice President, Cadila Pharmaceuticals Limited. You have the floor, sir, for 5 minutes.
Thank you, Gurjit Singh ji. Good afternoon and good morning to all honorable ministers and dignitaries, Ambassador Gurjit Singh ji, and august audience. First of all, I would like to thank for inviting us as a Cadila Pharmaceuticals to speak on this occasion, and especially about the subjects of India-Africa collaboration, which has been very near to our heart, starting from our founding chairman, late Shri I. Modi, to our current CMD, Dr. Rajiv Modi. Because we started with philosophy of making the affordable medicine available to the common people around the world. And therefore, we started our presence in Africa way back, few decades back to be precise. And today, we are proud to be present in almost all countries of Africa. Also, since this time, in fact, we have been participant to this event for many years, and I myself have been personally involved in this event for last 3 years. But this year's event has become more interesting with your presence, Gurjit Singh ji, considering that your name has always been known in India-Ethiopia collaboration every time whenever we speak at any place. And Ethiopia being our second home, I would like to start from there, and probably that would be one of the key aspects to support what we are talking today, which is about augmenting the healthcare system in Africa. And one of the way we look from pharmaceutical perspective is to talk about local manufacturing. We have been in Ethiopia for so many years. We have not only driven our own company, but taken the standards of pharmaceutical industry and manufacturing to next level there. As we know that Ethiopia, like most of the African country, is moving about local manufacturing to next levels in terms of what we call in pharmaceutical parlance, good manufacturing practices. And we take a lot of pride in being instrumental into it. And also what it demonstrates is during the period like COVID, where the local governments and local population was looking for immediate help, this kind of local manufacturing has helped a lot. And if I have to give an example, like in Ethiopia during COVID, when the sanitizer was looked upon, we risen to the occasion, making it available across the population and all government sectors. So this is what probably talk about local manufacturing. And we continue to do our expansion there locally in Ethiopia, and also looking at some other countries. And I'm sure this kind of forum would allow us to make certain points, whether it's about financing, local financing in Africa, or about regulatory support, because that's the key part from the pharmaceutical side. And if more consistent and friendly policies can be made, would be help for us to go forward from here on. It is needless to say that pharmaceutical segment or the healthcare segment, it's growing segment in Africa. It's expected to reach around $70 billion by 2030. Also, India always plays an important role. 20% of Indian export of pharmaceuticals are going to Africa. But what is key is to know that Africa, being 11% of the population of world, has the disease burden of almost 24%. And therefore, it's imperative upon all of us as a humans and society to see that how we can alleviate this burden from African continent. And therefore, I talked about local manufacturing, but also is critical and more realized during the period of COVID is about digitization. Also about tele-consultation and telemedicines. And that is where we take a lot of pride that we played a lot of role to—
1 minute, sir.
Yeah. We have taken an effective role in helping the humanity out there. And this digitization has helped to have less, in-clinic waiting time, better appointments, etc. and that has helped to provide the better medical services there. Also, we look forward to more budgetary support from the governments in Africa. I'm sure they are doing best, but there is a long way to cover. We still remember the Abuja Declaration where 15% of public spending was committed to the healthcare segment. There is a way to go, but surely there is a lot of progress has been made. And I'm sure more and more friendlier environment will help organizations like us who have very clear intention as part of their organization commitment to help and alleviate and improve the health standards in Africa. Thank you very much once again for inviting us.
Thank you, Mr. Sisodia. Yes, I do remember that when I was ambassador in Ethiopia, we inaugurated the Cadila plant. And this is when the late chairman, Mr. I.A. Modi, was there. And I think that has played a very good role. And similarly, Indian companies have invested in select African countries, largely for their domestic markets. I think the Deputy Minister from Kenya also spoke. So one of the reasons why their markets don't expand is because of cumbersome registration procedures. I'm sure once those are overcome through the AMA, perhaps the same plants in countries can have wider hinterland of supplying quality medicine. Thank you very much for your contribution. I have now with me Mr. Diptendu Bhattacharya, Vice President, Godrej and Voice Manufacturing Company, who is now going to talk about a different set of possibilities. You have the floor, sir, for 5 minutes from now.
Thank you, sir. My greetings to the respected guests of honor, my esteemed fellow panelists, Ambassador Singh, and all the participants in this conference. Allow me to just on my presentation. I hope it's visible to you now.
Yes, please carry on.
My organization, Godrej and Voice, has been in business for over 120 years. We operate through several business units, all engaged in manufacturing various products, catering to both the domestic and the international markets, including Africa. The healthcare challenge in Africa has been very well enumerated. It's a vast continent with a huge population and very heavy burdens of healthcare. The Indian healthcare environment is pretty similar. We are a large population of 1 billion plus, the majority of whom live in the rural areas. Healthcare infrastructure is a major challenge. Reliable power is not available either. When things get difficult, we've got to come up with innovative solutions, as you can see from this image. In response to these challenges, we've established a large network of primary health centers and community health centers in the public space. The private sector too has supplemented this effort by creating health infrastructure to help along. And we have a large pool of healthcare professionals to deliver these services. We also focus on immunization of our population through a vast infrastructure. A little more on that. To deliver this immunization program, we have an extensive cold chain network to deliver immunization to a targeted 27 million children. So there are a number of vaccine storage depots and delivery sites where this activity is carried out. It's through a team of over 250,000 health workers who actually execute this through off-site activities, which actually cater to almost 60% of the total vaccinations conducted in the country. The remaining are done in these fixed centers, which you see above. Now, there are several challenges faced by the cold chain managers. Vaccines require storage at 2 to 8 degrees Celsius. And India being a tropical country, temperatures often hover in the range of 25 to 45 degrees plus. On top of that, power supply is unreliable in several places. And you require a vast array of refrigeration equipment, portable vaccine carriers, vaccine refrigerators, freezers, and so on. And another challenge is the inadequate data on monitoring the performance of the cold chain. If temperatures are not maintained properly, the vaccine efficacy is compromised. As you can see, there is a congruence in the challenges that India and African nations face. India has created capacities on several fronts to meet this challenge. We have dwelt on the pharma sector. Some of the speakers before me have done that. Vaccine production too, we rank #1. And we have several healthcare players in the private sector to establish facilities. In addition to that, India has a strong manufacturing base for medical equipment and furniture, which are required especially for these healthcare facilities.
1 minute, sir.
Thank you. And we also manufacture refrigeration equipment for the cold chain. These refrigeration equipment are supplied to several global markets, including Africa. They meet the WHO pre-qualification requirements. We also make solar direct drive refrigerators, which do not require storage batteries and can yet deliver cooling for 24 hours of the day. India has supplied such refrigeration equipment to several African nations. I will just touch upon Mali and Niger. The majority of the vaccines installed here right from Godrej, India, under UNICEF programs. You have other multilateral agencies fund such programs in the world. In addition to immunization, you also require to supply unique furniture and laboratory infrastructure equipment for hospitals. Maintenance and calibration of this equipment is also very important. This is mandated by equipment manufacturers and certification bodies. It's a labor-intensive activity and requires proper training and equipment. I believe one of the previous speakers, Dr. Chandrasekhar, has touched upon the training aspect. So in conclusion, India has a lot of things in common with African nations. The learnings and the capabilities we have built up in the healthcare segment can be leveraged well to partner Africa in building up that infrastructure. Thank you, sir.
Thank you very much, Mr. Bhattacharya. I think that was a useful presentation of cold chains, particularly the work you've done in Mali. And now it's my privilege to invite Mr. Gautam Kumtakar, AGM Shapoorji Pallonji Company. You have 5 minutes from now, sir.
Thank you, sir. Distinguished guests of honor and delegates, good afternoon. Let me share my screen. So the economic prosperity of nations is strongly linked to the stock of human capital, consisting of health, among others. Two of the most commonly used measures of population health are life expectancy and infant mortality. The former captures the health impact of the disease, and the latter is the indicator of the state of healthcare system. The average life expectancy at birth in sub-Saharan Africa is about 60 years, with a maximum of 76 years and a minimum of 39. Some of the possible reasons for this could be healthcare, reduced healthcare services, dearth of healthcare workers, pharmacy, and logistics. Now, these were the findings of the pre-COVID era. Now, in a survey which was conducted by WHO in May 21, it was found that in some countries, crucial equipment and health workforce required to handle severely ill COVID-19 patients fall far short of needs. Now, of the countries responding to the survey, most have fewer than one intensive care unit bed per 100,000 population. Now, these issues of pre-COVID and post-COVID, or rather in pandemic, can be classified into the following baskets. One, lack of funding or affordability, shortage in healthcare infrastructure, healthcare workforce, supply chain, healthcare data, poor service delivery, and governance. In addition, in the survey done by WHO, a new head on lack of transportation was also mentioned. Now, one of the many solutions in this regard is telemedicine. Now, as mentioned by Ambassador Gurjit Singh in his initial talk, that telemedicine is present in almost 47 countries, but most of them are consultations. Now, moving ahead, now if a consultation procedure for a surgery could be conducted between hospitals in India and in Africa, combining this with a generic business model such as hub and spoke model, which requires a certain multi-speciality or a super specialty hospital in a country or in a region, catering to telemedicine centers, which could be multi-speciality and in turn further telemedicine centers. This requires a strong IT infrastructure as well as certain expertise present in all these centers. Now, further, they shall also connect with more centers, thereby catering to the most remotest part of the location. Now, construction of hospitals under concessional financing provides the much needed solution. This is also mentioned in the Exim Bank report, which was released in the inaugural session of this conclave as one of the strategies. However, packaging it with hospital operations under a concessional financing mode would provide a comprehensive solution.
1 minute, sir.
Yeah, the intention is to provide a one-stop solution for countries of Africa in healthcare. In order to encourage Indian healthcare players for more participation in Africa, concessional financing for operations of healthcare for a specific period, like 5 years, may be included. The funding could be total or partial, depending on the requirements. The partial funding could be covering viability gap or covering the working capital. Now, at the end of the term, the borrower government can take over the operations or extend the term on mutually agreeable basis. Now, some of the benefits that would go with this solution are affordable health, capacity building, both in terms of infrastructure and human capital, availability of healthcare workforce, better delivery, and better governance. Now, SP is into construction of hospitals from 1940s. We are a 156-year-old construction company and have constructed more than 45 hospitals with 20,000 beds, ranging from the most cost-effective one to the most expensive one. We design and build hospitals and other solutions in consultation with the client and have delivered quality products. We invite you to visit our stall in the exhibition section for more information. Thank you, sir.
Thank you very much. So I think we have had from the Indian side diverse presentations, and from the African ministers we heard their expectations. Personally, I believe 5 minutes is very unfair to every person who speaks. It is not enough time, and I think in future CII should give a longer session so that we can accommodate everybody well. But I would like to use the remaining time by returning to the honorable ministers and asking them to see if they have any particular idea after hearing the presentation. May I first invite His Excellency Dr. Edwin Dikloti from the Republic of Botswana, sir. Would you have any comments, sir, at this time? Is he there? Okay, so I don't see him right now. Would we have the Honorable Minister from Equatorial Guinea? Yes, there he is. Honorable Milan, you have the floor, sir. Please tell us from what you heard today, what is your takeaway? What do you think practically we can do?
Well, I've seen that the
there is a lot of possibilities, We Africans, we have expressed our need and the possibilities of collaboration, and that we have seen the potentiality of India from presentations from the work from Indian government and the private sector. What they are doing in Africa, what they are doing, giving us experience and more hope that whatever we are going to do, we are going to use this. Thank you very much.
Thank you, sir. Thank you so much. I really look forward to closer collaboration with Equatorial Guinea. I now turn to the Honorable Dr. Rashid Aman from Kenya. Sir, what would be your takeaway from this interaction today?
Thank you very much, Ambassador. I think this has been a very, very interesting forum of discussion. A lot of the things that have been presented here resonate very well with us. I think one of the speakers drew parallels between the healthcare situation in Africa and the healthcare situation in India and drew the similarities. Of course, in many ways, India has moved forward to addressing some of these challenges. And I think because of that and because of the similar experience, it's important that we forge a relationship. We already have strong relationship as a continent with India, but we need to strengthen that and move into now the space of actually building capacity and transferring technology to the African continent so that we too can be able to build those capacities here in a win-win situation. We don't have to look at it purely from a trade point of view. I mean, if we look at the trade statistics, for instance, between Kenya and India, I know that the balance of trade is hugely in favor of India. We need to be looking at ways, and we had a discussion with your Minister for External Affairs, was here. I know he opened this conference. He was here in Kenya a couple of weeks ago. I met with him. We had very good discussions. We talked about this issue of balance of trade. And I think that let us build on this. The ideas that have been proposed are great. The capacity and technology that resides in India is just as good as any other place in the developed world. But let's make this a reality. Local manufacturing, very, very key to us, both for pharmaceuticals, vaccines, as well as active principal ingredients.
Thank you.
Thank you.
Thank you very much. Is His Excellency Dr. Mangviro still with us on the panel? Perhaps not. Is Dr. Mario Joao from Angola with us?
No,
Yes,
I
sir.
don't have any other comment, Chairman. I think we are going in the right direction and we are happy. We hope the Indian companies have heard the message from Africa. Definitely, I saw all these things that are being produced and being done. I'm sure we'll be able to work together with the Indian companies and let's get the ball rolling now, not tomorrow, Mr. Chairman. I think this has been a very fruitful meeting and productive. We should be able to make things work again. And COVID is a lesson that we have all learned, and we do not want to be caught next time without readiness at our disposal. I thank you, Mr. Chairman.
Thank you, Your Excellency, Dr. Mangviro, for your very candid remarks. Is Dr. Mario Joao from Angola on the panel still? Perhaps not. So with that, I think I have the happy duty of concluding this session in time. I deeply thank all the panelists, honorable ministers, for your patience with me and your sticking to the time, which, as I said, candidly, I believe was too short. I think next time the session should be longer when we are discussing important things like health and also the diversity of the presentations. So I think one way of building this complementarity is a follow-up of this session through our embassies with the respective ministers of the private sector players who can then talk about specific things to do there and how to take them forward. I would leave it with that recommendation. And I thank CII for inviting me and allowing me to be a part of this conclave. Thank you very much, Excellencies, ladies and gentlemen. Good day.
Thank you, Ambassador.
Thank you, sir.